Good evening. Today we will going to have one discussion. We have one great personality, the nurse who worked in oncology. So she will introduce herself. Most of our students are not getting oncology posting. There is a little bit difference of the care between the general nurse giving care and oncology. Can you introduce yourself?
Yes, ma'am. Hey everyone, my name is Zavida and I have worked as an oncology nurse in one of the most renowned hospital in Kolkata. I have worked in that hospital from 2017 to 2019 July.
Very great experience.
Thank you, ma'am.
I would like to know there is a rights, patient's rights also there is there. That we will go before that. Medication is a common. Any diseases are coming medication. What is the big difference between the medication administration? What are the protocol will you follow in the normal, ordinary diabetic or hypertension patients medication administration or chemotherapy administration? What are the protocol? Is there any procedure you have to or any PPE you have to handle? The drugs are very much strong drugs are we are giving. Can you explain?
Yes, ma'am. First of all, it is very common for all the nurses, all the nursing students to follow the 10 rights of medications. Same as well for the oncology nurses, we follow that. Other than that, cross-checking of medications is very important in onco because you never know which drug you are going to administer. So for that, it is responsibility of us, the junior nurses, to counteract or cross-check the drug that you are giving along with your senior nurse. Or it might be the in charge, or it might be a staff nurse. It might be, but not the same with that same experience that you have. But that person should be a senior to you. So that is number one we have to follow. And yes, in oncology hospital, we come across many chemotherapy drugs. So these chemotherapy drugs we prepare in the biosafety cabinets using all the PPE, which we say personal protective equipments, right from wearing a cap to wearing a nitrile-free powder gloves to wearing a gown. Every PPE should be worn properly by the nurse who is going to,
disposable.
Yes, it is disposable. So we prepare this type of chemotherapy in the biosafety cabinets, not in a normal medicine room where we prepare other antibiotics. Another thing, the most important is whatever you wear while preparing chemotherapy drugs, all these PPEs are thrown into a yellow bin.
Oh, biomedical waste
Yes, that is very important. So this is how we actually follow. And yes, before
administration.
Yes, before administration of the chemotherapy, it is necessary for you to prescribe the pre-chemo medications drugs, right from pantoprazole to giving emisets, So these things are to be followed. And yes, you follow all these medications by.
Will you tell the side effects? But most of the drugs are lose your hair. Will you inform them, or you will inform? Doctor will inform about the side effects.
See, ma'am, actually, when the chemotherapy drugs are being made by the doctors, first of all, it is our responsibility to check the drugs. And then it is the nurse's responsibility to give health education regarding the side effects of every drug.
You will have one session?
Yes.
Wow. Mentally you will prepare the patient?
Yes, ma'am. The hospital that I was working, that hospital had their own protocols. Like we have a manual book where we followed like the side effects of some, common side effects of chemotherapy drugs, and what are the things we should do in order to combat this side effects. So these are the books that were available and which we were supposed to follow it and then inform it even to the patient attendants.
So you mean to say chemotherapy drugs are administered by counter-check by 2 nurses?
Yes, ma'am.
Like none other medications like 7 rights, 17 rights, but 1 nurse will, but you will be counter-check 2 medications.
Yes, ma'am.
Until then, your preparation room is different, administration will be in the patient room.
Yes, ma'am.
And will you observe the patient till the drug is going?
Yes, especially when the client is getting chemotherapy, you never know what are the side effects. What can happen. Allergic reactions can happen.
Because other
high blood pressure can occur, or even sometimes low blood pressure can happen. So you have to at least wait there and see and check, just like how we check the patient while giving blood transfusion. Yes. So in the same way, we have to check the patient every now and then. One example I would like to tell is if the patient is having MAB group of drugs, which we say it as monoclonal antibodies. So this type of drugs we used to set it in the infusion set.
Infusion set.
Yes. When we set it in the infusion set, if the doctors tell you to give it in a 60 per
Drops.
day, yes, drops per day,
Yeah.
you cannot directly give it in the 60, ma'am.
Oh.
So you have to escalate it. Like
Okay,
first
okay.
15 and then see for 15 minutes,
15 minutes.
if any kind of adverse effects are taking place to the patient. Other than that, if the patient is alright, if the vitals are okay, then we can escalate it to 20 to 25 and then finally reach 60.
60. One more thing. Chemotherapy, doctors are one therapy to the another therapy, 2 days gap they are giving. What
Yes,
about
ma'am.
chemotherapy?
Same thing.
Radiotherapy they are giving gap.
Yes, ma'am. Chemotherapy also depends on the cycle. Like one cycle can go for 48 hours like that.
Oh,
Okay.
slowly.
Yes, it will be going slowly like that. In that one cycle, the doctor might prescribe like cisplatin or maybe doxorubicin, something like that. So after finishing that, we escalate after 1 day like that. We will escalate to the day 2 like that. In the first cycle, the patient can go for day 1 chemo, day 2 chemo, day 3 chemo. It will be depending on the condition of the patient and what the doctor is prescribing for that patient.
Okay. And about that combination, chemo plus radiation they will give, or radiation separately they will give?
Radiation separately they give. Either the patient gets admitted for chemotherapy or maybe the patient will get admitted for radiation.
Radiation therapy, when the patient is transferred to the room,
yes, ma'am.
because he has some amount of radiation around his body, how many hours it will be there? What is your precaution?
Hours in a sense, it depends from patient to patient, ma'am. My precaution will be like before the patient is being transferred for radiation therapy, first of all we have to educate the patient like frequently hand washing, flushing the toilet after use. These are some of the most common. And this health education we give it to the patient attendant also, not to use the same toilet after the patient comes back. You know, and when they take care of the patient, they should maintain hand washing, like they should be able to maintain their personal hygiene like that. And the most important about radiation is we tell the client to do mouthwash, because not only for radiation, even for chemotherapy also, because one of the most common side effect of chemotherapy is mucositis. Same goes with radiation. So in order to prevent that, first of all, we give them chlorhexidine mouthwash. But when the patient is already having...
Directly you can use it or mix it with water?
We used to mix it with water and give. And then another thing is, ma'am, if the patient is already having grade 1 or grade 2 of mucositis, we cannot give them chlorhexidine mouthwash. Definitely it will cause them like burning sensation. So in order to avoid that, we go for soda bicarb mouthwash. Yes.
The statistics says that the 5,000 times the cancers are increasing in the world because of our technology. What is the common cancers for the different age groups?
Different age group, in my working experience, for the like children, pediatrics, if
Start
I
from
yes,
very painful.
Yes, ma'am. The most common that I saw is ALL, or in my opinion, it is a acute lymphocytic leukemia.
Oh, lymphocytic leukemia.
Yes. Or it can be a acute myeloid leukemia. So leukemia is one of the most common diagnoses that I have seen among the children. Yes. And another for the adults, like let's say for the females, if I see like most of the patient that I have handled was either CA breast or else it might be CA cervix or CA ovary. So these three are most common among the females.
Ovary prognosis is very slow.
Very slow, and also like there is a high chance of the relapsing case is very high in CA ovary. Most of the time I have seen that. Like the patient will be undergoing surgery or chemotherapy or even radiation, but there can be a chance of relapsing. It's very common.
Because ovary, it is surgery is very 0% chance to remove the surgical removal of ovary.
Yes.
And which stage will be surgery? First or second stage they are preferring?
First stage, sometimes first and the second stage they will be preferring, even in the third stage also. But most of the time, first of all, they will see the size of the cancer, ma'am. They will see the size of the cancer, they will see the size of the tumor. If it is operable, they will operate it. Otherwise, they will give chemotherapy first in order to shrink that tumor so that it can be excisable. So for that, they will be undergoing chemotherapy first of all in order to shrink the tumor, or otherwise, if the tumor is already small, they will excise it first and then go for chemotherapy, and then it will be followed by radiation.
Okay. This leukemia and other cancer, common cancer, you told, no?
Yes.
It is really difficult to treat, no? What are they doing, the intervention?
It is very
More
difficult.
prone to get to the infections, other infections.
Yes. It is very prone to get, especially someone who has undergone bone marrow transplant. So for this type of patient, they are completely isolated. They kept in isolation. Like after bone marrow transplant, the neutrophil count comes down to zero. Yes. It is high chance that you can get other opportunistic infections.
Yes.
So for that reason, even the visiting hours are limited for them.
This child will be away from the parents also.
Child
That
will be
is
away
also
from the
challenging to
Yes,
face.
yes, ma'am. It is heartbreaking and it is also very challenging for the client also, for the children also, even for the parents also.
Okay. Suddenly, like me, one person is coming like that. Suddenly, you are diagnosing. Who will ice break the diagnosis? Is it the patient right to know the diagnosis? Meanwhile, you have to see that emotionally how much he is able to take a chance and tell to the family members first. What is the protocol you are following? You will discuss with the family first?
We used to discuss with the family first.
Okay.
Actually, it is a saying like of course, every person has the right to know, ma'am.
Yes,
Even the patient has the right to know about their condition.
Because they will be like legally so much responsibility to take care. They may be thinking that 70 years they will live. Cancer lifespan, they have to go legal responsibility about their property and so many things are there.
Yes.
That's why I asked this question.
Yes, ma'am. Most of the time, we call it as breaking a bad news.
Breaking a bad news.
So this breaking a bad news is specifically done by the consultant or the consulting team to the family members. So some of the family members, they do not want their client to know it because of course they care for their psychological health, mental health differently. They used to care for that, so they want us not to tell them. But for how long? That is the question. Definitely, if somebody is undergoing chemotherapy, they will be knowing something is wrong with them.
One more thing will be that shopping of the doctors. Once I diagnosed as a cancer, I will have that idea whether another doctor, if I go there, my result will be changing. Like that, did you come across any patients shopping and leaving you and going?
Yes.
Then last will come back to you.
Yes. I have seen that, ma'am. Actually, shopping of doctors is not only for cancer, I feel. It is for
every
disease. It is we can see more often related to cancer because the word cancer itself is a stigma in India. Yes. There is a myth like cancer is contagious, cancer is a death sentence. These things are already a stigma. So in order to find a different result, like if...
Moreover, why stigma? Some people will tell they will cursing, somebody cursed, he did some karma, affected him.
That is the karma, that is the belief we have in India. So in order to hear something differently, we, of course, ma'am, we are human being and then we want somebody to say something good, something not bad. Okay, so actually we search for it.
Yes.
But that is actually not true.
Yes.
So these things I have come across. Finally they will be shopping, they will be going to Mumbai, they will be going to other places and then finally they will be coming back. Regarding this doctor shopping, I have seen one thing. He was a case of ALL and then he was getting his treatment under one of the most renowned hospital from UK. Okay. So at the last moment during his palliative care, he came back to India to the place where I was working and he got his last care there and he expired in that hospital in the last time.
Palliative in the sense the last 6 month care, whatever you are giving is a palliative. What was his, what he expressed emotionally, what he ventilated the patients?
The thing is he already had brain metastasis.
How old
he was only 19 years of age.
Wow, my
He was already 19 years of age and as he had brain metastasis and he was in the last days of his life, he couldn't reciprocate his feelings. He did not even know where he was. Where he was, who was taking care of him, like that.
This speaker will be there.
Yes.
That this one emotionally they will
Yes.
be don't know how to. Psychological problem will be
Yes,
there.
yes.
I tell you, we are telling the holistic care spiritually. The holistic model will be telling
Yes.
body, mind, and spirit.
Yes, yes.
I think cancer only the spirituality more you are giving relaxation. I have seen our posting was in Trichur hospital, cancer hospital. If you see every floor there will be a mosque, there will be a church, there will be a Hindu temple. Wherever the person is, they give much importance to spirituality. Did you come across any situation, anything?
Yes, I have come across this situation. I have come across, and then I myself I have faced that. Like most of the time when I was alone with my patients, like I cannot break down in front of them. But when the
you are an emotionally stable person.
Yes.
I am emotionally weak. I decided not to work in cancer.
When the attendant was not there, when the patient was alone, there were times when the patient was sleeping, and I prayed for them. Definitely,
Yeah,
yes,
yeah,
I
yeah.
prayed for them. These things happen. It is necessary, ma'am.
Is it any heart-touching moment there? Because you are praying means you are going so emotionally close with them. Any heart-touching moment that you forcefully went like that? Any incident happened for you?
Yes, I have come across so many of the heart-touching moments. One of the most heart-touching moment was it happened in the year 2018 in the month of February, date 14.
Oh, Lovers' Day.
Yes, where most of the people, like almost everyone round the corner, we celebrate Valentine's Day with our loved ones. I saw an aunt, a very old aunt, around 67 years of age, losing his husband on that very same day when we celebrate Valentine's Day. And the another heart-touching moment was a very young lady who just given birth to twin babies, and he couldn't even he just had few days of time with their child. Then because she had COVD.
Oh.
And she was already when she was diagnosed, she was already in her last stage.
Oh, that is the thing. CA ovary, once metastasis only it is come out to that. That I saw one patient also. They melt like a candle.
Yes.
They may be 80 kg. Within 1 month, they are half of. Did you notice?
Yes,
I
have
had
seen
heard
that.
the history of one patient.
So she delivered the twin babies, and right after the delivery, 1 week she had with her babies.
Did she give breastfeeding to the baby?
Just 1 week.
Allowed.
1 week. She didn't know that she had cancer at that time.
Oh my God.
1 week after the delivery, she was diagnosed with cancer.
Is it cesarean or normal delivery?
She had cesarean.
Then they have taken any sample of it?
After that, she did not show any signs. After 1 week, she started having the sign and symptoms. She started having pain.
Then they have done biopsy?
Yes. After that, she had biopsy, and then later on
Metastasis.
she was already in the last stage. She stayed for a month, and then she collapsed at last. And the last word that her husband uttered was, "Come back for the last time," and he was crying. And that was the most heart-touching moment for me.
And the baby is 1 month baby.
Twin
Twin
baby. She just had 1 week of time with them.
Young woman, no? Within 23,
Yes.
24
Yes.
years.
She was around 28 years of age.
Okay.
First woman yes.
Primary
She was a primary mother.
Oh, how you are a very bold. Really, I appreciate you. I work in ICU. I take it 1 week. I will cry, thinking, and the emotional stability, work-life balance. I felt that I could never have a work-life balance if I work like a cancer hospital. So I decided ICU, cancer, critical unit. I was like, I really appreciate it.
Thank you, ma'am.
And you also prayed with them.
Yes, of course.
That
So
time
many
only you
times.
were prayed. The
Yes.
spirituality we were speaking. So that
So
time
many
you have
times.
consoled them. And the pastors and everybody you are allowed, right?
Yes, it is allowed.
Allowed.
Like depending on your, like for example, if you are under palliative care, even the doctors allow. Even the doctors allow for that. Like if you want to call a priest or have a prayer, if you want to call anyone, like family members or have a prayer, they allow it.
They will allow.
Yes.
Okay. Cancer means new cancer is coming. When you are working in a unit, there may be some new research or anything. You have an idea what they are doing in new research.
Yes, ma'am.
Innovations in any technology they are bringing out in a diagnostic treatment, anything you can tell me.
New technologies and regarding new innovations, if we say, ma'am, there is CAR T cells therapy.
What is that?
CAR T cells is where they will take the T cells of the patient.
Mm-hmm.
They will be taking it in the lab. They will modify it.
Immunity,
Yes.
that is the one.
Yes. And
HIV AIDS affecting the T cells.
Yes. They will be modifying it into the lab, and then they will be infusing it back to the patient.
It will be very costly, no?
It is costly, ma'am. So they will be infusing it back to the patient, and this CAR T cells, what it will do is it will bind with the cancer cells and it will attack. Actually, once it gets infused back into the body, it will multiply. Once it multiplies, it will start attacking the cancer cells.
Then prognosis of the patient is good?
Prognosis of the patient is right now the research is going on. Yes.
In all cancers they are implementing
all
this?
cancers they are implementing for this.
Okay.
Another one is CRISPR technology. We say it as CRISPR technology. CRISPR technology, it is used to selectively modify the DNA. Like for example, they can modify the, like some genetic conditions like that, or some hereditary illnesses. So for that they are using. Another new innovations, if we say, is currently, of course, we are using robotic surgery.
Yes. Is it very much useful?
Yes, robotic surgery. And the newest, yes, it is AI. Artificial intelligence. Artificial intelligence right now they are using along with oncology, so that the treatment and the diagnosis and the screening of cancer will be faster. So they will be the diagnosis will be faster, the screening will be faster. It will help the cancer to be diagnosed
easily. Early diagnosed, because cancer is a multiple proliferation of immature cells. Very fast they are growing. How fast you are slowing it, how the prolonging the year.
It will be like early diagnosis leading to early treatment.
I have one myth. You might have collected the history from the patients. I will be thinking that non-veg people only eating non-vegetarian will get more cancer. But I have seen so many vegetarians also developing cancer in rectum. What is the reason, maybe? Is it any myths that vegetarian only get this colon, non-vegetarian will get this GI cancers?
Not exactly, ma'am. That is not exactly. It might be related to definitely gene.
Gene.
You will be exposed to so many radiations.
Like this one, rectum is highly vascular.
Yes, ma'am.
So cancer also, like lungs and rectum, very fast growth. I have seen one woman diagnosed as lung cancer. Within 3 months, she developed a lung cancer. Like it came out from the lung. So did you have seen like that kind of a patient?
I have seen a fungating wound. So fungating wound is something where the cancer, the wound protrudes outside your body.
Outside the body.
It is. People used to mistake it as like it looks like a fungus like that. It is a fungal infection, something like that, but it is actually not a fungal infection. It looks somehow like a cauliflower. It somehow looks like a fungal, like a flower, which we call it as fungating.
Sometimes this one I have seen vaginal examination.
Okay.
Patient who has a HIV positive, this fungal infection in the vagina. Vaginal, if you see the cervix full in the uterus, I have seen these patients.
Yes, ma'am. Fungating wound is different actually, because the wound which you have inside your body, it protrudes outside, and it becomes like a, sometimes the maggots formation will be there, and it will give a very much foul smelling. So that happens. Actually, that is not a fungal infection, but we call it as fungating wound.
Then prognosis will be very slow, no?
Yes, prognosis is very slow. Healing usually most of the time it doesn't occur. We on and off have to do dressing for that. So
any HIV patient with cancer, did you deal with them?
HIV, no, I haven't come across that.
No, yes,
I have not come across
because protocol will be totally different.
Protocol will be definitely different.
Definitely will be different with HIV, because HIV with TB usually will be coming. Also opportunistic infection, anything can come from the HIV patients.
And HIV infection, already the T cells are
already affected.
The immune cells are already affected. So, and then chemotherapy, what it actually do is, it will destroy the cells, making you feel more weak, So
we
it
do
will
not
definitely,
know.
yeah. So definitely the treatment will be little bit different as compared to the normal individual having cancer.
So we do not know what they are,
Yes.
what is they will do.
Yes.
Even immunization is impossible. In that kind of a virus also will be causing the disease for the HIV patients. Very good. Another myth is like if you work in a cancer hospital, you will face a problem of hair loss as well as infertility. Infertility.
Yes.
Many doctors are also infertile. So when I was a student, I was afraid to. This is the one reason.
Ma'am, actually working in a hospital, any type of hospital, definitely we come across so many problems.
Risks.
Yes.
In COVID, we have seen we lost so many of our doctor colleagues and the nurses. We lost.
You are you are psychologically affected sometimes. No, ma'am. So, but most of the time, it doesn't mean that if you work in a cancer hospital, you will lose your hair. It is not like that. Because in the starting of the video itself, I have said that while preparing the chemotherapy, we used to use biosafety cabinets, plus we use personal protective equipments. So these are some of the barriers, that will help you to overcome this problem. Another regarding infertility is, yes, it can happen, but I have not come across anyone who is working in oncology, having infertility problems, something like. I have not seen that.
Yes.
Most of the people that I know and I worked with had their families. Somebody who is working for the past 25 years in oncology hospital, having a very beautiful family. Definitely.
But few are having this one. We do not know what is the reason.
What is the reason? We don't know for that.
Okay. So cancer is the most prevalent. So prevention is always better than the cure. So the lifestyle disease, we can say it is a lifestyle. Though it is a idiopathic, though it is a genetic, prevention is better than cure. Can you advise some of the nutritions what you can give for this?
Yes.
Awesome.
Prevention of cancer, if we talk about, first of all, we should take prevention regarding the risk factors. Like we know that passive smokers, active smokers, it causes cancer. So you should learn to avoid, do not smoke. If you are a passive smoker for the last 1 year or something like that, you tell the other person the risk, what can happen.
And self-breast examination.
Self-breast examination in
Screening.
order to, screening,
Vaccine.
getting vaccinated
Vaccinated,
for
HPV.
HPV. Okay. And another one is like avoiding smoke foods in order to avoid CA
Best of all,
stomach.
if you see that there is something they are eating, no? Pan, something. Tobacco. They tell pan, something. Tobacco. A kind of tobacco.
Yes. Tobacco, definitely it causes CA tongue.
Yes.
Definitely you have to avoid eating tobacco, because eating tobacco will cause you CA tongue. And another one is maintaining healthy lifestyle, first of all. Maintaining a healthy lifestyle, you need to follow it. That definitely falls under primordial and primary prevention.
Vaccines we can take, and fruits and correct diet, skipping of the menu will be needed. And junk foods we have to avoid. And vegetables and something and all we have to clean it nicely, because pesticides they are using. Put a little bit of salt and soak it and clean it. Overcooking can be avoided. And the meat and other things and all will be boiled and it can be eaten.
Properly cooked.
Properly, and 1 to 2 years once, if a family history of this one, they can go for.
Another important is avoiding radiation.
Avoid radiation.
Yes, avoiding radiation. That is also important. And another important thing about cancer is, most of the time people say like palliative care is something which we give to the cancer patient at the last hour, at the last stage. But actually it is not like that. Palliative therapy, palliative care, it starts right from the
all the disease. It's like a rehabilitation.
Yes.
With rehabilitation, what we say, it is a psychological, social, all the measures to try again the person to lead a normal life.
Yes. So same goes with palliative. The myth about palliative care is like, most of the people think that we give palliative care only to the patient who is in the last stage of cancer. But actually it is not like that. Palliative care starts right from the time the patient gets admitted with cancer. So it goes along with the other treatment like chemotherapy, radiation, normal care like that.
With the spiritual and
Yes.
everything.
Yes.
Thank you very much. It was a wonderful discussion. You have taken me to the cancer hospital, and thank you very much. So the viewers got some idea about the cancer. Hopefully it will be motivating you all. Thank you all.
Thank you.